a parasitic skin infection triggered by the infiltration of the epidermis by the female sand flea Tunga penetrans, presents a substantial health concern in resource-poor communities across sub-Saharan Africa, the Caribbean, and South America, resulting in considerable morbidity and adversely impacting the affected populations. At present, there is a glaring lack of a highly effective drug specifically designed to address tungiasis, necessitating a randomized trial to explore potential treatment avenues. This comprehensive study, which included 108 participants with a combined total of 169 tungiasis-infested feet, sought to compare the effects of different treatments, namely topical ivermectin lotion, thiabendazole ointment and lotion, metrifonate lotion, and a placebo lotion. The findings from this trial bring a glimmer of hope to individuals grappling with tungiasis, revealing that all three active treatments, topical ivermectin, metrifonate, and thiabendazole, demonstrated a significant capacity to reduce the number of lesions caused by embedded sand fleas. This marked reduction in lesions not only provides relief for those afflicted by the condition but also signals a potential breakthrough in the ongoing quest for an effective and accessible treatment. However, despite these promising outcomes, the study emphasizes the imperative need for further research to refine and optimize the dosage and administration protocols of these compounds. Delving into the specifics, the study underscores the critical importance of fine-tuning the application of topical ivermectin, thiabendazole, and metrifonate. Achieving the delicate balance between maximizing treatment efficacy and minimizing potential side effects is pivotal to ensuring the successful implementation of these therapies on a broader scale. Additionally, the study advocates for a more profound understanding of the long-term effects and potential complications associated with these treatments, recognizing the significance of establishing the safety and sustainability of these interventions. Beyond individual relief, the implications of these findings extend to the broader public health landscape in hyper-endemic regions. Successful establishment of an effective treatment protocol for tungiasis has the potential to alleviate the burden on affected communities, contributing to improved overall health outcomes. Furthermore, the study highlights the broader significance of ongoing research and development efforts in addressing neglected tropical diseases that disproportionately affect vulnerable populations. In conclusion, while the results of the randomized trial offer a promising step forward in the pursuit of an effective treatment for tungiasis, the path to a comprehensive solution requires continued exploration and refinement. The groundwork laid by this study not only provides hope for those currently grappling with tungiasis but also opens avenues for further advancements in combating neglected tropical diseases, fostering a future where accessible and effective treatments are available to all. Please remember to subscribe to our channel, click the like button, and activate the notification bell if you wish to see more content like this. Thanks for watching.